Good morning, and I'm delighted to be able to give an opening message to this TSA annual conference. I'm sorry I can't be there with you this morning. As the Minister for Digital Health, I would love to be able to spend the day with you and to hear of the great progress that's being made on the technological and models for telehealth care and the digital technologies that are transforming our life and health sciences cluster. The truth is, this agenda goes right to the heart of the mission that the Prime Minister has asked me as First Minister for UK Life Sciences here at the Department of Health and Business to lead. And that mission is simple: to lay in place policies and a landscape to accelerate the uptake of innovation into our NHS, to help us do two key things. Firstly, to deliver more health and care for every pound we spend, and to do so in a way that makes the UK one of the world's most attractive places to come and develop the health and care technologies of the 21st century. We've traditionally supported the life sciences from the Department of Business, and in the 20th century that was largely about pharmaceuticals and med tech and devices and diagnostics. We recognise that in the 21st century the pace of technological progress, from genomics to informatics, in digital health, in devices, in diagnostics and in drugs, is transforming the way innovation is developed. And the key asset at the heart of that new research cluster is clinical information, clinical data, tissues, information on real patients in real time with real disease. And at the same time, the frontline NHS needs to embrace these technologies to help drive efficiency, productivity, patient safety and care. And that's why, as the First Minister with responsibility here at the Department of Health for all of the health data and digital health, I'm absolutely delighted to be able to join you by video today. And it's why, as a backbench MP, I led the 10-minute rule bill campaign for patients' rights to patient data. And I'm delighted that we've now put that into statute. And the UK is the first country on earth to mandate that every primary, secondary and social care professional must update a patient's record and make sure the next person on the care pathway has information on the treatment and the diagnosis that they've had. This agenda is key not just for 21st century healthcare. I want to argue that all health now is digital, but it's also key for the NHS to be able to fulfill its historic purpose. It was always intended as a research organisation and an organisation that could pool resources to improve healthcare for the next generation. And to do that, we need to be able to let the data flow across the NHS so we can spot CCGs that are outperforming, identify best practice, drive up standards, reduce variation regionally, and improve the efficiency of the sector. But I want to argue there's something else even more powerful. By putting information in the hands of patients, by allowing patients to access our health and care sector digitally, to allow loved ones to track their loved ones' journey, their diagnosis, we do something even more powerful, which is to take healthcare from something essentially in the 20th century done to us, passive patients by a benign health state, to a 21st century in which we empower active healthcare citizens to be able to take more choice and responsibility over their lifestyle and their healthcare outcomes. And that is a noble goal which I think should inspire us all. The opportunity is enormous, and so is the challenge. We have over 60% of adults in the UK now own and use a smartphone. Only 2% of them are using those devices to access the NHS. We use our phones and tablets to access every other walk of life. It's time now, finally, to complete the digitalisation of the NHS, and we've spent a lot of money and a lot of time on that. The key, I think, now is to give patients, users, compelling benefits in their hand of convenience and information and access. And that is what the Secretary of State and I are absolutely determined, and we've set out this summer a framework for doing just that. I want to pay tribute to Tim Kelsey at NHS England and to the National Information Board, who've pulled together the roadmap for Personalised Health and Care 2020. And together we've set out a series of milestones. From this coming spring, all patients will have access to their digital care record. It won't yet be like logging onto your online bank, but that's what we want it to be in due course. And by 2020, we intend to have fully interoperable patient records across health, GP, secondary and social care. There are some wonderful examples of best practice. At the Spire Hospital in Brighton, working with Sensium Vitals, using wearables to allow specialist nurses to monitor patients remotely. NHS Highlands are using the Babylon system to allow remote rural communities to do online telehealth, screening, diagnosis and consultations without the cost and time and delay of travel. And King's College doing extraordinary stuff with Apple on the Apple Watch to drive diagnosis and treatment. This new landscape, the pressure on the NHS England have signalled to us, unless we modernise care pathways, this old model of relying on treating chronic disease in hospitals is going to cost us an extra 30 billion a year by the end of this Parliament. By embracing digital technologies, we can diagnose earlier, treat smarter, keep people out of hospital, keep people fit, healthy and active and working, and avoid the chronic disease cost burden, which is going to swamp the NHS unless we can relieve it. The truth is, digital technologies have transformed other walks of life, from banking to travel agency to education, and they can and are beginning to do the same in health. My challenge to you as the innovators on the front line is focus on those innovations which don't carry technological risk, deliver benefits to patients, inspire clinicians and patients to support this agenda, and deliver tangible frontline benefits to the health system. I'm passionate and confident that we can do it. We need to put those benefits in the hands of users and patients. So this agenda isn't just about digitalising the system for the benefit of the providers. It's about empowering 21st century healthcare citizens to have the responsibility, the choice and the information in their hand they need to take those steps, to be active and to help take more responsibility for their health outcomes. Thank you for everything you're doing, and I look forward in the months and years ahead to supporting it here at the Department of Health and the Department of Business.